Welcome to Unit 2 of this module on detecting and managing STIs in pregnancy. In this unit, we will look at STI screening protocols and steps to diagnosis. By the end of this unit, you will be able to describe STI screening protocols. There are several ways to identify STIs and other RTIs during pregnancy. These include screening, which is testing all pregnant women with and without symptoms, case finding for pregnant women with certain risk factors that increase the probability of infection, and case detection, which is identifying pregnant women who have symptoms. The following steps may assist clinicians with STI, RTI detection. 1. Take history. 2. Physical examination. 3. Laboratory testing. It is important to cover all three steps where resources permit to arrive at the most likely diagnosis and to guide effective treatment. If laboratory testing is not available, follow step 1, history, and 2, examination, to guide initial treatment and refer for laboratory testing if symptoms persist. If a complete examination, including a speculum examination, is not possible, base initial treatment on step 1 and refer to a facility with speculum and laboratory testing facilities if symptoms persist. Let's now look at specific treatment recommendations. When taking the patient's history, ensure you include questions about previous pregnancies and their outcomes, current symptoms, and possible STI risk or exposure. Women who report a previous history of preterm labor or low birth weight should have a microscopic examination with treatment for bacterial vaginosis, Trichomonas vaginalis, and/or Candida albicans based on findings. Women with symptoms of abnormal discharge, itching, or burning should be treated for bacterial vaginosis and/or Trichomonas vaginalis, which are common in pregnancy. Candida albicans or yeast infection is also very common in pregnancy. Treatment for Candida albicans can be given if the woman describes a white, curd-like discharge. Women who may be at higher risk for STIs should be offered treatment based on the presence of cervical infection through a speculum examination. If not feasible, treat based on high risk of STIs. Examples of higher risk include multiple partners, a new sexual partner, or a partner with STI symptoms. The physical examination in early pregnancy should include both an external and internal or speculum examination with bimanual palpation. Vaginal discharge may be noted, but it is not necessary to verify the presence of discharge to give treatment based on the patient's complaint, as per step 1. Clinical examination should include an abdominal examination to exclude abdominal tenderness, rebound tenderness, or palpable masses, and an external vulvovaginal examination to observe any lesions, overt genital discharge, vulval erythema, and excoriations. On speculum examination, any signs of cervical inflammation, friability, or discharge should prompt treatment for cervicitis in addition to any treatment for vaginitis. A bimanual digital examination should be conducted to elicit cervical excitation tenderness and assess the presence of abnormal vaginal discharge and the color and consistency of discharge on the glove. Genital ulcers should be treated using the GUD table. Additional treatment for Candida albicans should be given if the woman's complaints suggest yeast infection, which is a white, curdy discharge with redness of vulva, vagina, and irritation or itching. Significant tenderness or mass on abdominal or bimanual exam should always be investigated for possible complications such as ectopic pregnancy, spontaneous abortion, or infection. The type and choice of laboratory tests available to clinicians may vary widely across and within countries. When lab tests can be done, they can help to reach a more precise diagnosis than would be possible with only findings from history and examination. Simple microscopy can help guide treatment of vaginitis by identifying specific microorganisms, for example, Candida albicans, which requires additional treatment. Simple staining, gram or methylene blue, of endocervical smears can also help identify gonorrhea or chlamydia. However, it can also miss many infections due to low sensitivity. Gram-negative intracellular diplococci indicate gonorrhea, while numerous white blood cells indicate cervical infection due to either gonorrhea or chlamydia. Since gonorrhea and chlamydia co-treatment is recommended, any abnormal finding on a stained smear leads to treatment of both infections. Women with positive NAAT results should be offered gonorrhea and chlamydia co-treatment. Finally, a woman with a positive or reactive syphilis result should be treated and followed through pregnancy and after childbirth as described later in this section and the next chapter. Abnormal vaginal discharge is one of the most common symptoms during pregnancy. Regardless of laboratory capacity, WHO recommends careful history taking and examination to guide diagnosis and treatment. For women complaining of vaginal discharge, good practices include taking a medical and sexual history to assess any likely risk of exposure to STIs, conducting a clinical examination, including an abdominal examination to exclude abdominal tenderness, rebound tenderness, or palpable masses, and an external vulvovaginal examination to observe any lesions, overt genital discharge, vulval erythema, and excoriations. Conducting a bimanual digital examination of the vagina to elicit cervical excitation tenderness and to assess presence of vaginal discharge and the color and consistency of the discharge on the glove. To ensure effective STI detection, in addition to routine screening, look for STIs if symptoms or certain risk factors are present. A history of problems during previous pregnancies, including spontaneous abortion and preterm labor, may indicate a need for STI testing. And a physical examination, including speculum examination, can help detect cervicitis and internal genital ulcers. You've now completed Unit 2 STI screening. In the next unit, we will explore STI treatment in more detail using STI treatment tables.